Today, I want to explore something that many people might not immediately link to depression, anxiety, or even psychosis: inflammation. Most of us think of inflammation as what happens when we twist an ankle or get a sore throat. It gets red, it swells. But inflammation can also exist at a low chronic level, simmering quietly in the body. Recent research is showing us that this type of persistent inflammation may be an underappreciated driver of psychiatric symptoms, and perhaps a hidden reason why some people don't improve on standard treatments. We'll look at what the science tells us, how it impacts the brain, ways we can test for it, and what we can do about it, and how all of this fits in a holistic plan of care. We'll look at what the science tells us, how it impacts the brain, ways we can test for it, what we can do about it, and how all of this fits into a holistic plan of care. Inflammation is our body's natural response to injury or infection. It's meant to be short-lived, helping us heal and fight off threats. But sometimes this response doesn't turn off properly. We end up with chronic low-grade inflammation, where the immune system stays slightly activated over time. So why does this matter for the brain? Inflammatory molecules called cytokines can cross the blood-brain barrier or signal through the vagus nerve. Once they influence the brain, they can change the way neurons function, affect neurotransmitters like serotonin and dopamine, and alter stress hormone systems like the HPA axis. For example, elevated inflammation is linked to reduced serotonin availability. It may also increase glutamate toxicity, which can impair brain circuits tied to mood and cognition. So essentially, chronic inflammation can shift the brain's chemistry and wiring in ways that mimic or worsen psychiatric symptoms. Let's look at inflammation's role in psychiatric conditions, just focusing on a few. In the context of depression, large studies show that people with depression often have higher levels of inflammatory markers like high sensitivity C-reactive protein, or hsCRP, and interleukin 6, or IL-6. This might explain why some people feel sick, tired, or achy when depressed, similar to how we feel during the flu. In the context of psychosis, research on first episode psychosis shows elevated inflammatory markers, suggesting inflammation might even be involved in early brain changes. In the context of anxiety, fatigue, and brain fog, chronic inflammation also disrupts mitochondrial functioning and neuroplasticity, which can contribute to cognitive slowing and fatigue. Emerging research is also linking bipolarity to elevated inflammatory markers as one of the initial events leading to bipolar disorder. In short, we are learning that for many people, mental health symptoms may not only be, quote unquote, in the head, but also in the body, linked to immune processes. Here's where it gets even more interesting for people who've tried medications without full relief. Several studies have shown that high-sensitivity C-reactive protein levels greater than 1 milligram per liter are associated with poor response to SSRIs, or selective serotonin reuptake inhibitors. And you may be curious as to why. Inflammatory cytokines can reduce serotonin production, increase its reuptake, and trigger neurotoxic pathways. This means the same antidepressant may work differently in someone with high inflammation versus low. It's opening doors to personalized approaches where we consider inflammation levels before deciding on treatments. So inflammation can be evaluated in a variety of ways. The first is through standard labs. The high-sensitivity C-reactive protein, or hsCRP, is the most widely used, Levels above 1 milligram per liter suggest significant low-grade inflammation. The erythrocyte sedimentation rate, or ESR, is another general marker, though less commonly used. More specialized or functional medicine testing include panels that look at cytokines like IL-6, tumor necrosis factor alpha, and interleukin-1 beta. Additionally, tests for gut permeability can illuminate underlying inflammation as well. There are other clues in routine labs, such as a mildly elevated fasting glucose or triglycerides, a low high-density lipoprotein or HDL, or slightly elevated liver enzymes. All of these can hint at metabolic inflammation. A good integrative evaluation looks at these labs alongside history, lifestyle, diet, stress, and even trauma, since these all interplay with inflammation. There are several supportive strategies that help to reduce inflammation. In the realm of nutrition, anti-inflammatory diets rich in omega-3 fatty acids, leafy greens, berries, turmeric, and nuts can lower cytokine levels. Reducing ultra-processed foods and added sugars is key. In the realm of movement, regular, moderate exercise decreases inflammatory markers and boosts brain-derived neurotrophic factor, or BDNF, which supports brain resilience. Practices like yoga, meditation, and breathwork have been shown to lower inflammatory gene expression and calm the HPA axis. For select individuals, nutrients such as EPA-dominant fish oil, curcumin, vitamin D, and N-acetylcysteine, or NAC, have evidence supporting inflammation reduction and mood benefits. Finally, probiotics and gut healing protocols can reduce systemic inflammation by strengthening the intestinal barrier. So this is where integrative psychiatry shines. Instead of asking only, "What diagnosis do you meet?" we ask, "What is driving this unique pattern in you?" We look at biological factors like inflammation, hormones, and gut health, psychological layers, patterns of thought, emotional processing, and so on, social and existential factors, including meaning, relationships, and life stressors. Within the model of coherogenesis, we see each person not as a collection of broken parts, but as a dynamic whole system striving toward coherence. Symptoms like depression or psychosis may reflect disruptions in this system, with inflammation as one thread of the story. By addressing inflammation alongside psychotherapy, lifestyle shifts, and sometimes carefully chosen medications or supplements, we support the person's innate capacity to reorganize toward greater coherence and well-being. If you, or someone you care about, has struggled with depression, psychosis, or fatigue that just doesn't resolve, consider whether chronic inflammation could be a hidden contributor. By taking a whole person, integrative approach that explores the body and mind, we open the door to more personalized and effective healing. Thank you so much for exploring this with me today.